Hello everyone, welcome to Renal Rehabilitation Laboratory. This is you, a physical therapist. This time, I'd like to talk about this question. Does regular management of physical activity and physical function have any impact in ambulatory hemodialysis patients? Renal Rehabilitation guideline said that hemodialysis patients should be assessed their physical functions regularly, and people are increasing who have concern about it. So, let's learn about it. Today, I'd like to talk about this retrospective cohort study. Utility of regular management of physical activity and physical function in hemodialysis patients. Several clinical practice guidelines recommend regular assessment of physical activity and physical function as part of routine care in hemodialysis patients. However, there is no clear evidence to support these recommendations. This study investigated whether the proportion of attendance at a regular program for management of physical activity and physical function can predict all-cause mortality and cardiovascular events in hemodialysis patients. This is a retrospective cohort study. They assessed the eligibility of 550 outpatients for inclusion in the present study. Of these, 238 patients refused to participate in the study and 46 participants died or changed clinic within 3 years after obtaining baseline measurements. Therefore, this study consisted of 266 hemodialysis patients participating in the management of program at least once. Participants were tracked for 3 years after their first attendance at the management program to determine their attendance proportion. As there are no established management program attendance proportion categories for hemodialysis patients, the patients were divided into two groups according to the median. Patients who attended over 75% were high attendance group, and patients who attended 75% or below were low attendance group. This is the histogram of proportion of attendance at the management program. 98 patients attended 100%. The main study outcomes included all-cause mortality and a composite of fatal and non-fatal cardiovascular events. Cardiovascular events were defined as death from cardiovascular causes, hospital admission for non-fatal myocardial infarction, angina, and heart failure. This is the table of characteristics of the participants at baseline. Median patient age was 64.5 years. 45% for women, and the median time of hemodialysis was 35.5 months at baseline. There were 65 deaths during a median follow-up of 79 months in the total population, consisting of 35% death in the low attendance group and 12% death in the high attendance group at the end of follow-up. Kaplan-Meier curves followed by log-rank tests showed that the rate of all-cause mortality was significantly greater in the low attendance group than the high attendance group. 60 patients showed fatal or non-fatal cardiovascular events over a median follow-up of 68 months, consisting of 31% patients in the low attendance group and 30% patients in the high attendance group. Kaplan-Meier curves showed by log-rank tests showed that the incidence of fatal or non-fatal cardiovascular events was significantly higher in the low attendance group than the high attendance group. This is the table of the risk of all-cause mortality and fatal or non-fatal cardiovascular events. Results reported as hazard ratio and 95% confidence interval from Cox proportional hazard models. Model 3 were adjusted for age, sex, BMI, serum albumin, serum C-reactive protein, physical activity, maximum gait speed, comorbidity index, and incidence of non-fatal cardiovascular events within 3-year survey period. Even after adjusting for any of prognostic models, the hazard ratio for all-cause mortality in the low attendance group was 1.79 compared to the high attendance group. On the other hand, even after adjusting for any of the prognostic models, the hazard ratio for the incidence of fatal and non-fatal cardiovascular events in the low attendance group was 1.84 compared to the high attendance group. Receiver operating characteristics curve analysis was performed for the logistic regression models of baseline characteristics only and baseline characteristics plus proportion of attendance at the management program. On evaluation of all-cause mortality, the AUC was significantly better for baseline characteristics plus proportion of management program attendance than for baseline characteristics only. And on evaluation of the incidence of fatal and non-fatal cardiovascular events, the AUC was significantly better for baseline characteristics plus proportion of management program attendance than for baseline characteristics only. Chronic kidney disease is an independent risk factor for frailty, and frailty is a predictor of injurious falls or fractures, hospitalization, and mortality. But physical exercise interventions improve physical function, including muscle strength and aerobic capacity in hemodialysis patients. Wearing a pedometer, setting activity goals, use of step diary, and feedback from medical staff were shown to increase physical activity by providing motivation, reaching approximately 1,000 steps per day in hemodialysis patients. In elderly patients on hemodialysis, low-intensity intradialytic exercise was shown to increase physical activity both safely and effectively. These observations suggest that physical function and physical activity in hemodialysis patients can be modified, and therefore conditions of frailty should be managed as part of routine care in such patients. Clinical geriatric practice and geriatric research involve assessment of physical performance and physical limitations to gather information on well-being and quality of life, and to determine care needs and prognosis. In aging research, measurements of physical activity and physical function are utilized as independent predictors of various adverse outcomes. The need to assess physical activity and physical function has also been advocated in the field of nephrology research and practice. Expert clinical guidelines from the Kidney Disease Improving Global Outcomes (CKD Workgroup) and European Renal Best Practice Guideline Development Group recommend that nephrology and dialysis staff should incorporate routine assessment of functional status and encouragement of physical activity as part of routine clinical care. Despite these recommendations, there have been no changes in practices. The inclusion of exercise recommendations in the guidelines was not sufficient to change practices. A recent multi-center clinical trial of a simple home-based exercise program managed by dialysis staff among dialysis patients indicated meaningful physical performance benefits among those participating in exercise. In the present study, the median proportion of attendance at the management program was 75%, which was within the range reported in the other studies. In cardiovascular patients, it is clear that attending a higher proportion of cardiovascular rehabilitation sessions confers greater long-term benefit than attending fewer sessions. The results of the present study showed that active attendance at a management program reduced mortality and resulted in less fatal and non-fatal cardiovascular events compared with lack of program attendance. These results support the recommendations for assessing physical activity and physical function as part of routine care in hemodialysis patients. That's all. Thanks for watching. What do you think about this topic? If you have any ideas, feel free to write it on the comments. See you next videos.